Well, our big focus is the UK. UK entered the next phase of its vaccination drive against COVID this Sunday as the list of those eligible for jabs was expanded from over 60s to all those aged 56 and over. Now, the expansion comes as the NHS staff has said more than one-third of the adult population have now received a life-saving jab. Vaccinations are now being administered at more than 1,600 sites across the country, including temples, mosques, museums, even rugby grounds with a maximum 10-mile radius of availability of at least one vaccination center. The UK has approved 3 vaccines, Moderna, Pfizer-BioNTech and Oxford-AstraZeneca vaccines. Now, the latter also has a tie-up with the Serum Institute of India, and a batch of 10 million doses from India was sent to add to Britain's vaccine stockpile. In fact, our External Affairs Minister also tweeted about sending those vaccines to the UK. Well, to talk more about this entire program, we're now joined by our guest, and joining us is Dr. Veer Pushpak Gupta, a member of the National Health Service. And thank you so much for being with us once again, Dr. Gupta. First and foremost, tell us about the vaccination drive. It seems to be moving swiftly, one-third of the adult population vaccinated. And good to know that Indian-made Oxford vaccine is also a part of the kitty there.
Yes, absolutely. Thank you for having me on the show once again, Gargi. Yeah, it's a very proud moment for India that we're sending vaccines to the United Kingdom. 10 million doses were received in the UK just a few days ago. And as you mentioned, Mr. Jaishankar, he tweeted it as well. So very, very proud moment for India. And the Serum Institute is doing a great job in providing vaccines all over the world. Very interesting, some data that I have actually for you. Some studies have been done by Public Health England, and they're showing some really positive data coming out from the vaccination drives that have been happening since December till February. And they collected all this data in the last 2.5 months. And it shows a good comparison between Pfizer and AstraZeneca. And it says that after 1 dose of Pfizer, the people that were above 70 years old saw about 57 to 61% immunity, and that increased to 85% after the second dose. And after 1 dose of AstraZeneca, people saw about 60% of immunity at 28 days and 73% at 42 days. So clearly, even 1 dose of the vaccine is providing very, very good results. We had about 50,000 cases about a month ago, which have now gone to about 6,000 cases per day. So a huge drop in cases in the UK. And as you mentioned, every available space is being used to vaccinate as many people as possible. And I think the numbers are going up daily. More than 20 million people have been vaccinated so far. And it's going to only increase in the time to come.
Right, and that's interesting for us to know that, how the vaccine drive is just, they're pushing it all over the country. As you said, many centers where vaccines are being given. Here in India, of course, we have government hospitals and private hospitals so far that are giving the vaccines. What's very interesting for us is also, since, you're using the Oxford-AstraZeneca vaccine, which is known as Covishield here in India, that it has been found that a 12-week gap between the 2 doses it raises the efficacy of the vaccine. Now, here in India, we have a 4-week gap between vaccines. So this is something that we're hoping, authorities here will take into account. Tell us a bit about that.
Yeah, look, Public Health England took a different approach to vaccination from day one, and they did it different to Europe. They did it different to the United States. And what they said was that if we're going to get 10 million doses of the Pfizer vaccine in the UK, we're going to vaccinate 10 million people with those 10 million doses, rather than keep 5 million doses for the first dose and then 5 million doses for the second dose. That way you only vaccinate 5 million people. So 10 million people were vaccinated with 10 million doses, and then the second dose was delayed to more than 3 months or 4 months down the line. Now, there's 2 reasons for that. One, you vaccinate as many people as possible in the community. And even with 1 dose, all the studies that have been done so far show that the vaccination will give you 70% immunity even after 1 dose. And if you've had COVID before, then that 1 dose, the first dose, acts like a booster. So if you've had COVID before, your body already has antibodies, and then the first dose that you get acts as a booster. So it kind of reminds the system that, listen, you've had COVID before, make those antibodies again. So the strategies seem to work because we can see the decrease in infection, and we can see that things are getting better. The other thing about the delay in the second dose is that your body gets time to make those antibodies and increase the immunity within your own body. So that's also very important. And there's no real-time there's no publication on it yet, but the data that is coming out from real-time studies done by Public Health England shows that the strategy seems to be working.
Right. And Doctor, so now given that the numbers are coming down, the vaccination drive is moving smoothly, now restrictions are being lifted, schools reopening?
Schools have reopened this morning. That's correct. A very well laid out plan was given by Boris Johnson a couple of weeks ago, where by the 17th of May, mostly all restrictions in the United Kingdom will be lifted. Travel will restart. And, social distancing measures will start to decrease, and mask wearing and all of that should still go on. But I think by the summer, we're hoping that more than 30 to 40% of the UK's population, or at least the vulnerable population, would have been fully vaccinated. And I think the ease on the NHS will decrease and things will start to get back to normal.
Right, and this despite the fact that, the Kent variant, or the variant that was discovered in the UK, has been found to be more infectious, but you've managed to move your vaccination drive very, very swiftly and get ahead of the virus.
Yes, and that's actually a very important point that you brought up, because the studies that I'm talking about today, there's a Siren study that was done by Public Health England, and also another study done to check the virus in over 70s and how the vaccination affects people over 70. And both those studies have shown that the vaccines are effective against the B.1.1.7 variant in the United Kingdom. So I think that has been a huge factor in decreasing numbers in the last few months.
All right, Dr. Veer Pushpak, thank you so much for joining us again on the show.
Thank you for having me. Thanks.
Thank you. Well, let's take a look at our second topic now on the show. In India's first multi-center randomized controlled trial on the use of a drug, tocilizumab, in COVID has demonstrated that the anti-inflammatory treatment reduces the risk of death among patients with severe COVID. Now, the results of the trial were published in one of the world's top journals, the Lancet Respiratory Medicine. India's largest study on this was conducted from May to October 2020 at, several centers, if I can just get up that number, 11 public and private hospitals across 10 cities, and 180 patients were recruited for this study. Well, to talk more about this, we're now joined by Dr. Arvind Singh Soin, Chairman, Institute of Liver Transplantation and Regenerative Medicine, Medanta Medicity, and one of the leads on this study. Dr. Soin, so tell us more about this drug and tell us more about the study that was conducted.
Gargi, as far as the drug is concerned, it's basically a drug that decreases the inflammation, which is part of the story why the damage happens in a patient who gets COVID-19 infection. So this is being tested across the world in several trials. And India's first trial on using this drug in COVID-19 patients was concluded, like you said, last year. And after that, we've obviously analyzed the data and submitted it for publication. It just recently got published on the 5th of March. And we showed in this study that the group of 90 patients who received tocilizumab versus the group of 90 patients who did not and just received standard of care, their mortality and need for ventilation was no different. But when we did a subgroup analysis on these patients, we found that patients who had severe COVID-19 infection, if you gave them tocilizumab, the death rate among them reduced. So there's a clear demonstration that the correct timing of using this drug, tocilizumab, is in severe patients with severe COVID-19, and it reduces the risk of mortality among them. Incidentally, you were just talking to this expert from the UK, and there are two other studies in the UK done recently.
Right, I was going to ask you about those.
Came out,
yes.
Yeah. So they came out last month.
But they have not been peer-reviewed yet. They've also conducted similar studies using this drug, which is an arthritis drug for caring for patients with severe coronavirus, only in severe cases, as you said, and this is a drug that helps reduce mortality.
One of the studies is now published. The recap map study is now published, and the other study was the recovery trial. And both these trials also showed results similar to what we saw, that tocilizumab was good for severe COVID-19 and it reduced mortality among these patients. So they also showed the same thing. And in fact, the UK NHS have now adopted tocilizumab as a part of standard care for severe COVID-19 patients. So what this study does is, it prevents us doctors from using this drug indiscriminately among all hospitalized patients, because that wastes resources and doesn't necessarily save lives, and gives us the direction that the patients who are suitable for using tocilizumab are patients who have severe COVID-19 infection. And that's what we should follow in India now.
Right, Dr. Soin, what we've also found very interesting for us who, non-medical during the course of this pandemic is this repurposing of medicines, because these are medicines that are already being used, to treat other ailments. For example, tocilizumab that is being used to treat arthritis, and now you've managed to, repurpose it to actually treat cases of severe COVID. So that's been very interesting during the course of the pandemic.
That's absolutely true, Gargi. Making new drugs takes a long time, takes 2 or 3 or maybe more years. Average drug cycles are between 7 and 10 years to make a new drug. So you have had to look at repurposed drugs, and that's only natural. And in fact, now there are 2 drugs that have been shown to reduce mortality in COVID-19. One is steroids, and the other is tocilizumab when used in severe patients.
And when we talk about treatment for COVID, yes, it is something that's going to take a long time. But is there anything that looks promising to you at the moment?
There are several studies going on the use of antibodies against the spike protein as treatment. Of course, we know that antibodies against the spike protein are also part of the vaccine in many situations, which is being used to protect us against future infections. But these antibodies have also been used for treatment in experimental situations. So perhaps in the next year or 2, we will have antibody treatment as well as antibody vaccines. We must understand that despite the vaccine drives going full throttle across the world, COVID is not over. And we're probably going to have to live with some COVID infection happening in society. So we must understand how best to treat these patients when somebody gets COVID-19 infection.
All right, but in terms of not having any, very short treatment as of now, vaccination is our best bet at the moment, and, the vaccination drive that's underway?
Absolutely. And like I said, it's going to take a year or 2 at least before we have definitive specific treatment for COVID-19 infection. Until then, we have to make do with repurposed drugs and, of course, the usual COVID-appropriate behavior, along with quick vaccination of large populations of people so that you build up herd immunity and you have at least 50 or 60% of populations vaccinated and or having had previous infection so that you have herd immunity and life can return to normal as we know it over the next 6 to 12 months.
All right. Thank you so much, Dr. Soin, for joining us on the show and talking to us about your study.
Good to be on the show. Thank you, Gargi.
Welcome back. Well, let's now take you through the COVID numbers and the data we have currently. So we're going to the COVID site on NDTV.com, and there you can see India numbers. India, 18,599 cases in the last 24 hours. So let's just take a look at the vaccines so far, and there you can see how our vaccination has improved, and currently India vaccinating 14,24,640 this is on the 6th of March. But there you can see we've vaccinated over 2 crore people so far, though it has to move faster if we're to vaccinate 30 crore people that we're planning to vaccinate by August. Remember, currently India, we're vaccinating those over 60 and those over 45 years of age with comorbidities, that's serious illnesses. And there you can see the vaccination, how we compare with other countries. United States has vaccinated 87.91 million, followed by China, European Union, United Kingdom, India. India is there with 20.99 million by the 7th of March, then England, Brazil, Turkey, Israel, and others. So let's just take a look at the daily tracker, and this is how our curve is currently moving. Cases did come down, but now there's a slight increase in the number of daily cases. As we said, it's over 18,000 cases for the 3rd day that we're seeing daily cases being reported, over 18,000. The worries are a few of the states. In fact, there's 6 states that are the big worry. And here you can see Maharashtra at the top with 11,141 cases being reported in 24 hours. That's the highest number right now in India. And Kerala reporting 2,100 cases, followed by Karnataka, Andhra Pradesh, Tamil Nadu, and then Delhi as well. So these are the is how it stacks up. But these are the problem states, so to speak, which are reporting the most number of cases. And remember, central teams have now been sent out to these states to help them in handling the COVID situation. Punjab too remains a big worry, and here you can see the numbers from Uttar Pradesh, 115 in the last 24 hours, West Bengal reporting 188. But the big worry remains Maharashtra with 11,141 cases. And let's just take a look at the growth curve. And these are the states that are the big worry. And you can see the curve here. The red is Maharashtra and how it's going, how high it's going, over 11,000 cases being reported there. Kerala, Karnataka, Andhra Pradesh and Tamil Nadu. And you remember, Tamil Nadu is also facing election, Tamil Nadu and Kerala. So that's a big worry as many of the leaders are hitting the campaign trail and holding massive rallies over there. But to end on an optimistic note, the Union Health Minister, Dr. Harshvardhan, has said that we are in the end game of the pandemic here in India, but we have to continue following the COVID protocols. And he said it's very important that we rely on science, we don't get into the politics of vaccination, and ensure all our near and dear ones, whoever is eligible for the vaccine, goes ahead and gets it.
I would appeal to all of you. You see, I personally feel that COVID, if all of us remain together and if we have the right, I think that the country has the right approach. COVID is already on its way out. The only thing that we need to ensure is that number one, to keep politics out of the war against COVID. I think that's the most important thing, which unfortunately few in our profession are also not able to understand and appreciate. And then the second important thing is to appreciate the role of science, and to appreciate and learn and also respect the contribution of science. And then, of course, the third thing that I feel is most important is to create a sort of a movement for ensuring that maximum people, they get vaccinated against COVID.
Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.